Our widespread scientific research shows children are less likely to catch COVID-19, and should they catch it, the overall risk of hospitalization and death remains low, with the exception of those with comorbidities. However, the Delta variant has affected teenagers and school-going children to a large extent. So how worried should we be about our children? Well, let's chat now to Nicoletta Hay, a pediatrician at Morningside Clinic here in Johannesburg. Doc, a very good afternoon, and thanks so much for your time. What are you seeing in terms of children with COVID? Are infections on the increase there, especially with the new variant?
But definitely more children are getting this new variant. More children are testing positive. The latest report from the National Institute for Communicable Diseases from about June 16th to 2021 shows that about 10% of all positive COVID tests are for children between 0 and 19 years of age.
All right. Sorry, go on, Doc. Do go on.
What's important to know is that of the hospital admissions for coronavirus positive patients, only 4% of them are for children 0 to 19 years. And of people that die from coronavirus-related illness, about 0.7% of those were children. So the vast majority of children are still getting this new variant much milder than do adults.
So those who are dying from it, Doc, are they children with comorbidities? Do they have other illnesses? What is leading to those deaths?
So if you divide the in-hospital deaths from coronavirus in children, about a third happen in children under 1, about a third or just over a third are for children between 15 and 19 years, and the rest are kind of in between. And of those that died, more than half of the ones that were able to be analyzed properly had more than one comorbid condition. So that's a condition that may make the disease more serious.
Yeah. Okay, so we know that it is flu season here as well now, and kids are getting sniffles as well. How do we know, how is COVID presenting in kids, and how do we tell the difference? How do we know when it's time to go and test our kids for COVID and it's not just flu?
So it's important to note that coronavirus can present and look, it's almost impossible clinically to differentiate between coronavirus and things like influenza and rhinovirus and other upper respiratory tract illnesses. So the truth is that without a test, it's impossible to differentiate. But because children are getting this mildly, it's not necessary to test every single small child with respiratory tract illnesses. Only those that need admission or are looking more serious would probably need a test.
All right, Doc, very quickly before I let you go, I just need to know from you, when do we sort of, how do we treat our kids at home? Just some very quick tips, because I do have to go to KZN in a couple of seconds.
Yeah. So children at home are treated symptomatically. They do not need any medication that would prevent or treat the virus. They would be treated with paracetamol, non-steroidal anti-inflammatories, keep up with fluids, perhaps some vitamins in malnourished children or who have specialized diets. And there's no, practice social distancing, ventilate the rooms, and just treat them like you would any other child that has an upper respiratory tract infection if they are mild.